Hi, Gabby. Okay, we're going to begin our press briefing. My name is Peter Zanoni. I'm Corpus Christi City Manager, and this is our joint City of Corpus Christi, Nueces County COVID-19 press briefing for today. And today is Wednesday, the 20th, right, of May. So it will be just myself, and then Annette Rodriguez will be speaking as well today. Today I'm going to do an update on our statistics and give a quick recap on some of our public safety folks that are in quarantine. That came up yesterday, and since that time we've gotten an update, and we'll talk to the community about how they're doing. And then Annette Rodriguez will talk about some of the military testing that's going on, the National Guard testing, as well as an update on some of the senior center testing that our fire department is doing in conjunction with a statewide effort managed by the National Guard and the governor. Okay, so every day at 4 o'clock we look at the number of cases that have that we've picked up from the prior 24 hours, and so we're reporting 8 additional new cases today, as you can see in the graph here. So that brings our total to 256 since we've been counting, and not all 256 are active cases. There's been a recovery rate of 127, and we'll show you a graph on that later. But since we've been tracking, we do have 256 cumulative to date. There are 3 deaths that we have been reporting, no changes there. 3 deaths in Nueces County as a result of COVID-19. And our distribution of the male versus female with respect to the total number of cases continues to be more male dominated. The 8 new cases since yesterday, 7 of those were male and 1 was female. So when we look at the total number of cases, 256, 59% are male and 41% are female. For many weeks it was almost a split, 50-50, but in recent time there's been more male to female. And then when we look at our age distribution, it had been that there was a pretty good distribution across about 6 age groups. We track it by 9 different age groups. But recently, with some of the cases in the last couple of days, you can really condense, or the majority of the cases are found in 4 of the age categories. So 75% of all our cases are in the age group of 20 to 60 years old, basically. So 20 to 60 years old has 75% of all the COVID cases. And then number of testing, the community likes to hear that and wants updates on that. So today, between the city, the National Guard, and the private sector, that being hospitals, private physicians, commercial labs, in Nueces County, there's been 247 tests performed. So that brings our total tests that we've been counting performed in our area to 7,383 for Nueces County. Okay, we're going to show you this donut chart here. This shows recovery rates. It's getting better since earlier this week, and especially since last week. So we have more persons recovering than new cases added. It's about 50%. And in the lighter blue to the right, 127 persons have recovered. And then we still have 126 confirmed active cases. And then we do have 3 deaths, so that's the smallest slice there. There's been a change in the hospital status. We had 5 in the hospital as of yesterday, but 1 person was admitted, so now we have 6 in the hospital. And 2 of those 6 are in intensive care, and then the other 4 are recovering in regular care. The 8 new cases since yesterday were all residents of the city of Corpus Christi, and the city of Corpus Christi has the majority of the 256 cases. Rural Nueces County has 11, Port Aransas has 7, Robstown 4, Agua Dulce has 1, there's 1 in Bishop and 1 in Driscoll, and still 0 in Petronalia. Okay, let's look at some of our trending graphs. So this graph shows the number of tests performed per day, and those are the blue bars that are going up and down. And then the orange line going across, orange or red line, is the 7-day average number of tests performed a day based on a 7-day average. And so as of today, we have 290 tests performed per day using a 7-day average. 290 is our running 7-day average for tests performed. And then when we look at number of COVID cases, we're glad to see that drop from that big spike that was due from 2 outbreak areas. But the numbers are coming down, or the average number per day is coming down. So this graph shows the average number per day, the running average. We have 10 per day is our running total per day, using a 7-day average, right? 10 per day. Okay, so that concludes the update on the statistics. Gabby, if you want to translate that, and then I can do a quick update on the first responders? Okay.
Las cifras más recientes indican que en las últimas 24 horas se han reportado 8 casos confirmados por el virus, haciendo un total de 256 casos. 152 son hombres, 104 son mujeres. La mayoría se encuentran en el rango de edades entre 40 y 49 años. A la fecha se han llevado a cabo 7,383 pruebas por el virus entre el Distrito de Salud Pública, laboratorios privados y la Guardia Nacional. De los 256 casos, la gran mayoría son residentes de la ciudad de Corpus Christi. 4 son residentes de Robstown, 7 de Port Aransas y 11 son residentes de áreas rurales. 127 de los 256 casos se han recuperado por completo. 6 personas continúan en el hospital. 2 están en la unidad de cuidados intensivos. 126 son casos aún activos. Hasta la fecha se reportan 3 fallecimientos.
Okay, great. Thank you, Gabby. Okay, now we're going to do a quick update on our first responders, and then we have some civilian staff that manage our detention center, where persons that are apprehended by the police department are taken as their first step. So last week, there was an incident where the police transported a suspect or subject who was later determined to be COVID positive. And so the number of police officers that were involved in the end that had contact with this individual was 4. And then he was taken to the city's detention center, and there were 7 city staff members that interacted with the subject through the period of his booking and eventual release. So that's a total of 11 in that category because of that one person who was apprehended. So those folks are in quarantine for a 14-day period, and today marks about the 1-week period. It was a week ago or so today, so they still have 1 week to go before they're released from quarantine. We did have the detention center persons tested at the National Guard in Robstown, but we may not have the results back in time to beat the next 7 days, so we'll see. We'll monitor it. If we get the results back, then there's different steps that we could take. But suffice it to say, they're in quarantine right now, making sure they're not interacting with others. They're not showing signs of having COVID, but our best practice is to keep them quarantined. And then on the fire side, there was a transport last week of a patient from a nursing home, and that individual was later determined to have COVID-19. And so those 2 firefighters have been detained in quarantine as well, I should say. And they're in that 7-day period, so they have another 7 days to go. And by next week, they'll be released, from quarantine. Okay, so that concludes that portion. We're going to have Gabby translate that, and then Annette's going to come up next. Thank you.
En resumen, la semana pasada le informé sobre el personal de seguridad que estaba en cuarentena luego de un incidente ocurrido el 11 de mayo. 4 oficiales de policía y 7 oficiales del centro de detención de la ciudad habían sido puestos bajo cuarentena debido a que la persona detenida en el incidente resultó positiva a la presencia del virus. De ese grupo, 2 bomberos aún continúan aislados en una estación de bomberos, mientras que un total de 14 empleados están bajo cuarentena como medida precautoria.
Thank you. Annette Rodriguez, Health Director. So testing in the community continues at any of the military testing team locations. You can call the 512, the 883-2400, or you can go on texascovidtest.org to get more information. They're also continuing to test at the Coastal Bend Wellness Clinic. They're going to finish that up this week, and so you can call that number as well. It's 356-9572. That's area code 361-356-9572. We continue to receive a lot of inquiries regarding negative tests and employers that are requesting negative test results so that people can go back to work now that the governor has moved to phase 2 of the reopening Texas. I want to take the time to explain to everyone what a negative COVID-19 test really means. If you have received a negative result from a PCR test, the test where they swab your nose or your throat, that means that at the time the sample was collected, you did not have the virus in your system. A negative test does not mean that you are immune to the virus. It simply means you did not come across the virus at that time and were not infected with COVID-19 at the time you were tested. Even with a negative test result, you are still at risk of contracting the virus if you are not careful. So it is important that you keep following all the preventive measures we've been talking about. 3 of the best preventive measures are to continue to practice social distancing and always wear a mask when you go out in public. Wash your hands often with soap and water. These simple measures can help our community in the fight against COVID-19 here in Nueces County. I want to also give you an update on the nursing homes. Our nursing home testing continues in collaboration with the Corpus Christi Fire Department and Christus Spawn. We have done 5 nursing home facilities to date, and 7 nursing facilities are scheduled for the next few days. The Health District also continues to work with our halfway homes to ensure that everyone is offered guidance as needed. As of today, we have a total of 21 confirmed cases at the Avalon Transitional Center. The Dismas House is still at 19 positive cases there. The Health District will continue to do everything we can to reduce the spread of disease, and we hope that the community can help us with this undaunting effort. Stay safe, stay well, and as always, stay informed. Thank you.
En resumen, continuamos realizando la toma de especímenes en asilos de ancianos en todo el condado de Nueces y continuamos contactando todos los casos que resulten positivos. El día de hoy tomamos especímenes en 5 asilos de ancianos. Hemos recibido muchas preguntas sobre pruebas negativas y empleadores que solicitan resultados de sus empleados para que puedan volver a trabajar. Si recibió un resultado negativo de una prueba para detectar el virus en su sistema, eso significa que en el momento en que se recolectó la muestra no tenía el virus en su sistema. Eso no significa que usted sea inmune al virus, solo significa que no lo había encontrado y se había infectado. Aún con un resultado negativo, corre el riesgo de contraer el virus si no tiene cuidado, por lo que es importante que siga todos los protocolos de prevención. 3 de las mejores sugerencias de prevención que tenemos es continuar practicando el distanciamiento social, usar siempre un cubrebocas y lavarse las manos periódicamente. El Distrito de Salud continuará haciendo todo lo posible para reducir la propagación de la enfermedad y esperamos contar con la participación de la comunidad. Si usted quiere hacer una cita, puede llamar a la Guardia Nacional al 512-883-2400.
Okay, great. That concludes our prepared remarks. Just a couple of kind of housekeeping things for the rest of the week. So tomorrow is Thursday. I'll be here tomorrow, and Nueces County Judge Barbara Canales will be presenting as well tomorrow, and then Mayor Joe McComb. That'll be tomorrow. And then on Friday, we're going to have Texas A&M back again. This will be their 6th or 7th week. Is it their 6th week, Steve, or 7th? It may be their 6th week, so or 7th. We'll confirm it tomorrow. But they continue to update the modeling for our community. The tracking the cell phone data. That's a real unique thing that that a lot of people across the country are using. That tool to see how we're doing on social distancing and that type of stuff. So they'll be here Friday. That's Dr. Bird, that I know a lot of our viewers like to watch. He'll be here. Dr. Tussaud, also from the university, will be here. He generally doesn't speak, but he's part of the team. And so they'll be here with updated projections, modeling, and recommendations from a scientific and scholarly standpoint. So that concludes our presentation. We want to thank the media that's here with us today, carrying this coverage live to some extent, Color Times as well as here, the newspaper. And we want to thank those that are watching on Facebook and YouTube. We appreciate you watching and helping you stay safe and helping your family, friends, and others stay safe. This is good information for you and good information for the community. So with that, we'll take any questions that you all might have.
Hello. This is probably more of a question for Annette.
Okay.
Just kind of an update on the cartridges that were received yesterday and kind of like how long they last, like kind of what's like the shelf life for those.
I'm not certain on the shelf life for the cartridges. I know that we go through them very quickly. So Spawn did notify us yesterday that they had received cartridges, and so they had enough to do the testing for a full day. And I think it was because the number of people to be tested were around 360 people. So for one day, and then we'll do the testing the following day. So we go back and forth. Whoever has the supplies are the ones that gets to do the test.
Sure.
So.
And is there any other kind of concern for other testing supplies that they were running potentially low on?
No, right now we're in good shape with the VTM. So the test tubes that we use to collect the specimens, we have plenty of those to finish out the nursing homes. And we did get notification from the state that we're going to get some more nucleic acid. So that's great news to be able to do another at least 120 tests. And so the nucleic acid continues to come in and the supplies. We keep requesting them through the STAR up to the state, and then they send us the supplies as needed.
That's all I got. Thank you.
Mm-hmm.
Okay, great. Do we have any other questions for today?
One.
One for Annette?
No, for you.
For me?
One.
Okay, on the side? Okay. Okay, great. Okay, well, that concludes our briefing today. Thank you, everybody, for watching, and stay safe. We'll see you tomorrow.